So we are live. Hi, Supernaturals. It is your host, Beverly Hines, the founder and CEO of Hair Scripts, the platform that is empowering Black and Brown women to regrow healthy hair effectively by connecting you to specialists who can assist you with your hair growth. So I'm really, really excited about my guest today, Dr. Akingboye. I want to make sure I said that correct.
I know you did. That was good.
That's perfect.
Thanks.
She is a board certified dermatologist. She coins herself as the expert injector, and she is a cosmetic dermatologist. So I'm really excited about having her here today. We've had several guests that would come on and talk to us about holistic healing or naturopathy. But today she's here to talk to us about specific treatments, cosmetic treatments that can help us with our hair loss or hair restoration. So Dr. Akingboye, if you can start off by telling us a little bit more about yourself, your history, and how did you get into dermatology?
Great. So I actually went to school in Brooklyn, medical school there at SUNY Downstate. And while I was there, I got the opportunity to shadow another doctor during my second year. And that's how I got into dermatology, essentially. I got to experience seeing derm patients and what it was all about. I love the mix of medicine and procedures um, into something that is visual too. So I'm a very visual person. When I was a kid, I was an artist. I really like painting, drawing, writing, anything that had to do with the visual, I was into it. So dermatology pulled me in that way too. I loved all the rashes and seeing patterns and being able to tell another doctor that wasn't a dermatologist, hey, this is what this is.
Exactly. So let's talk to the supernatural community and squad for a minute. So what's the difference between medical dermatology and cosmetic dermatology?
Oh, sure. So I actually practice both medical and cosmetic dermatology. And pretty much medical dermatology, we're talking about rashes, acne, things that are covered by your insurance. Cosmetic is more of appearance wise. So not necessarily a rash, but more I want Botox or I want filler or, my hair is not doing what I want it to do. And there are medical treatments for hair loss, but there are also cosmetic treatments as well.
And that's really good that you bring that up because I'd like to address both. So let's talk about medical treatments for hair loss versus cosmetic treatments. And as a dermatologist, what makes you lean for one over the other when you're treating a patient?
Absolutely. So I always go to medical first.
Okay.
And the reason why is it's effective. Not that cosmetics aren't effective, but it is effective and it's inexpensive. So
Okay.
it's something that you can get covered with your insurance, or if you have to pay anything out of pocket, it's a very minimal amount. So an example of medical treatment for hair loss would be something like Rogaine
Okay.
or Kenalog injections. So those are two examples of something medical to treat certain types of hair loss. And I would go to that first over doing a cosmetic procedure. So PRP, for example, is cosmetic, and that would be something that I would go to later on if medical treatment is not working for you.
Okay. So let's talk about Kenalog injections. So
Sure.
what exactly is Kenalog injections?
So Kenalog is a steroid actually, and we use it really common in dermatology. So we use it for pimples that are really painful. We can inject that and that'll help it go away quickly. But we also use it for certain types of hair loss. So steroids are anti-inflammatory. So if your hair loss is caused by inflammation, then injecting the steroid will tamp down the inflammation and hopefully improve the hair growth.
So let's talk about your process to treat or for treating hair loss. So someone, and I know it's not a one size fit, but someone usually comes in. How can you determine whether that's inflammatory, an inflammatory process problem versus something else?
Right. So my number one go-to is to listen to the patient first.
Okay.
Because sometimes you're telling me something that's helping me say, hey, you know what? This is an inflammatory process, or this is, autoimmune, or something else. So family history is something that's important. But also, are there any symptoms associated? Does it just happen, or is it itchy or painful? All these things can help guide me to one diagnosis versus another. And then, of course, the examination too, looking at your scalp and determining, is it red? Are there bumps there? What kind of hair loss is going on? And it can put you in a category of treatable with steroids or not treatable. So that's an example.
So at what point do you say, because you always say you like to start off with medical
Yes.
treatments. So at what point do you say, hey, let's try PRP? And then let's explain what PRP is for our audience.
Sure. So I would use PRP in a patient that's tried, for example, if you have female pattern hair loss and you've tried Rogaine, you've done all the hair vitamins, and you don't feel like you're where you want to be, then that would be the point where I would recommend PRP. PRP is platelet rich plasma. And so it's pretty much the idea of it is you healing yourself. Your
Okay.
doctor will take a vial or two of your blood. We spin it down in a centrifuge, and that separates the different parts of your blood. And the part that we take from that is called plasma, and we inject that back into your scalp. In the plasma are platelets and growth factors, and that is supposed to help induce more hair growth.
Okay. So, and I just out of curiosity, what are one of
Mhm.
the factors that the platelet has in it that's beneficial to your hair or scalp?
So they're proteins and they're different growth factors. So that's what's in there.
Okay. Awesome. And so I just want to talk about just kind of park with the PRP for a minute and just kind of talk about
Mhm.
what that process is like. So I come into your office and we've gone through everything, and now you're like, okay, Beverly, PRP. So how does that work as far as the injections? How many processes or how many injections do I need? How does that work?
Oh, great. So usually I recommend a series of 4 treatments,
Okay.
and I say to separate them by 6 weeks.
Okay.
Okay. And the first treatment is about 20 minutes long. And really, part of that is just drawing your blood. And then the second part is spinning it down in the centrifuge, which takes about 6 minutes with the system that I use. And
Okay.
then the injection part doesn't take too long, maybe another 5 to 10 minutes. You actually have to do it pretty quickly after spinning it down so that the growth factors are still active when you inject it.
Okay. And here's a question that we all want to know. Is it painful?
Yeah, so I've had it done myself.
Okay.
And I'm not gonna lie, there is some discomfort the
Okay.
first time you get it done. But once you get used to it, it's actually pretty tolerable. It goes by very quickly.
Okay.
But to describe the sensation, it's kind of it's not the needle that hurts so much, it's more of the push afterwards. It feels a little burny sensation. But
Okay.
I do a couple of tricks to help distract you, and
Okay.
I find that my patients tolerate it pretty well.
Okay. So I want to talk about your practice for a second. And I'm just curious because one thing I feel I haven't seen, and maybe, you can give me from a different perspective, is
Right,
as African American and Latinx women, we may not tend to either pay for cosmetic treatments or want to pay for cosmetic treatments.
right.
Do you see that trend in your practice? Do you see a lot of people coming in for medical dermatology versus cosmetics, or the other way around?
I see a good mix of both, but I will say that I do think that Black and Latinx women don't seek cosmetic treatments as often
Mm,
as our fairer counterparts. And a lot of that has to do with socioeconomic issues, which is a whole long American story, right? So that starts from somewhere.
and
But
yes, I
yeah, no,
if you think it's do you think it's mindset shift? Because let's be honest, we spend
uh-huh,
money on the things we believe in, right?
exactly,
I had Dr. Yolanda Lenzi on here a few episodes ago, and she talked about about consumerism and how minority women or multicultural women spend a lot of money on beauty, over the counter beauty products.
right,
But then when it's time for them to spend money on cosmetic treatments, there's some reluctance and hesitance. So
right.
my curiosity is still asking, why do you think that is, and how do you think we can solve that problem?
Well, I think it's, yeah, part of it is a socioeconomic issue, but then another issue, because yeah, you're right. We spend money regardless of how much we make. We'll drop
Mhm.
$500, $1,000 on a weave. I mean, we spend a lot of money on ourselves. So why not
Yes.
cosmetic procedures? And I think part of it is that one, we don't age as quickly.
Okay.
And part of that is melanin, right? We're genetically blessed. So, you could be 50 and look, amazing and never had done anything at all, depending on your family history and how well you took care of your skin. So there's this thought in the Black community too that you don't need cosmetic procedures to keep up. So it's tough because we all age in the same predictable way, but
Right.
I think it's a slower process for us because of the protection of melanin that melanin gives us essentially.
And I really love that you brought that up because melanin
Mhm.
is skin related. And
Right,
one thing, for some reason, we all really care about, and not to go back to that, is our hair. At
right,
that point, when we start noticing that something is happening to our hair or with our hair, that's when we're running and we're looking for some type of solution to stop the bleeding.
right.
And so, for me overall, I wonder if you have the same reluctance when it comes to now hair treatments, cosmetic hair treatments. Hey, I'm recommending this, but your insurance is not going to cover it. Do you get that same reluctance?
I don't think so. I think there's more reluctance to buy Botox and filler
Really?
than than it is to buy PRP.
Wow.
And I think the reason why is because as a culture, we're so used to spending a lot of money on our hair.
Right.
It's just what it is. And if our hair is falling out, I feel like people will spend the money if they have to.
Mm.
Yeah.
Listen, if we highlight that, because it's really good
Yeah.
to know. The second thing is I do want to stop and talk about skin for a second because I know we are hair scripts and we are the platform about hair and hair restoration, but overall we
Right.
are a wellness platform. We're about beauty and wellness. So I want to talk about Botox and fillers for Black women. That's something that we don't hear about a lot. Like you said, we age well. Black don't crack.
Right.
So
Exactly.
what are your thoughts about that? What are your recommendations? Do you feel at some age we can start kind of being proactive with Botox and fillers?
I think it's a good idea.
Mm,
Anytime you start doing cosmetic procedures, that's where you start slowing the aging process even more. So, for
mm,
example, I started, and this is just because of access, because I was a dermatology
right.
resident. So, I started doing Botox and filler myself when I was around 27, 28 years old. And so, I feel like that's helped keep me looking younger in a more natural way. I
Mhm,
think another part of the reason why Black and Latinx women don't seek treatments too is this fear of looking odd. And I think people who end up looking odd after doing cosmetic procedures, one, it's the injector, but I think another part of it is when did you start doing it? So,
okay.
if you all of a sudden wake up when you're 55 or 60 and you're like, oh my God, I don't like the way I look anymore, my face is sagging, and then you start doing procedures, I feel like you have a higher risk of looking odd than you do if you start when you're younger.
Mm,
And I think it's very crucial, especially when you're older, that you go to someone that's experienced with handling faces, because a lot of people do injections and not everyone is as good.
yeah, girl.
Right. Yeah.
You're
So I think it's a range, and I think you want to make sure you go to someone who's had the experience of injecting different faces. If you go to someone who's not so experienced, then you have a risk of looking odd, especially when you're older. When you're younger, I think it's you can get away with it, but when you're older, you really want to go to someone who's experienced.
So automatically I start to think, well, what do I look for? What questions do I ask if I'm looking for someone or I'm going into an office for Botox and fillers and I know nothing about this? What do I look
Right.
for to know that they're actually experienced?
Right. So I think a lot of people's knee jerk reaction is actually not asking about experience, but price shopping. So we get a lot of price shoppers. I'm comparing price, and everybody wants to save money, and we do sales all the time. But I think that shouldn't be your number one question. Your number one question should be, how often do you do this?
Okay.
How many years have you been doing this? What has your training been? I think the best injector you're going to get is going to be a physician. Okay. And then I think the second most important thing is, how long has that physician been practicing and how long have they been doing cosmetic procedures? What has their training been? So all those things are important.
Mm. And then I like to ask this question for myself.
Mhm.
So there's a lot of new trends that are coming out, like doing the non-invasive rhinoplasty with Botox.
Right.
Talk to me about that. Is that something you've done? Do you agree with that?
Right. So yes, I have done that.
Okay.
And I think it depends on the patient. It's not for everyone. And I don't think every nose can be corrected with filler.
Hmm.
It's filler, not Botox,
Okay.
that the non-invasive nose job is done with. But I think it's a good option for certain people, especially if it's something minor that you're trying to correct.
Hmm.
Yeah.
Okay. And is it permanent, or is it something that you have to constantly go in for?
Right. So filler is not permanent. It usually lasts about a year, depending on the type of filler you're using. For the nose, it would be about a year.
And thank you for the correction. So let me ask, what is the difference between Botox and fillers?
Yeah, I'm sorry. You did ask me that earlier, and I think we got caught up in another topic. So Botox is a toxin actually derived from botulinum toxin,
Oh.
and we inject it directly into a muscle to stop muscle movement. And
Mm,
the reason why we do that is because your facial expression muscles, there are what cause certain lines, particularly here. That's the most common area people get Botox in initially. We call them the 11. So they're the vertical lines that you get between your brow.
okay.
That is where Botox is used most commonly. But also the horizontal lines on your forehead.
Mm.
So
And
those
what
are two examples.
the smile lines? Because I got those.
Yeah. So smile lines are actually filler.
Oh, okay.
Yeah. So we inject filler into areas that are more shadowed or look like there's volume loss. That's where filler goes.
Mm. Okay, so you said the earlier you start, the better.
Yes.
I just want to highlight something you said because I want our listeners to hear this.
Right.
Not about going in there just to look cute, so to speak, but it's good for preventative maintenance. Like if you
Right.
want to slow down the progression of, aging, which is going to happen to all of us, guys.
Right.
It's
It's
inevitable.
normal.
Right. You know, may not hurt to go in and get filler and or Botox, depending on what your recommendation is, right?
Right.
And because a lot of us do things like we drink collagen, we do this, we do that, we take a whole bunch of supplements. Uh,
Right.
but you know, it's not to say it's apples and oranges, but definitely kind of weigh your options and kind of see what they are because it's something.
Right.
I learned something new today because I just thought, hey, as I get older, when I start to sag, when I start to notice it a lot more, that's when I'm gonna go in. But you're
No, it's better to start earlier. Yeah.
That's good to know. So I want to ask you about
Mhm.
this novel that you are planning
Oh,
to write. I don't know if you started it yet, but talk to me about that. And does it have anything to do with dermatology, or is this just a passion project?
it's a passion project. So
Okay.
I've been writing since I was a kid. So I've written two novels and I have one novel that I'm working on now, but I haven't been published yet. So that's really my dream is to be a published novelist.
Okay.
Yeah,
Speak it into existence. It will come.
exactly. And
Yeah.
I write, so it's young adult novels that I write and
Oh,
nothing to do with dermatology. So,
nothing to do. Wow. Okay. See, I love
mhm.
that. I love asking when I have specialists come on the platform. You're so much more than your zone of genius, right? There's so
Right,
much more to you. So I really love to ask. I mean, I have people that have been hairstylists and cosmetologists and so many other things.
right.
So for you to say, I'm a novelist, I really, really love that. So you can definitely relate to us on so many different levels, especially with your creativity. So speaking of creativity, when
Right.
you see someone walk into your office who can use your help, does that same creativity activate where you can say to them, hey, I know you're in here for this, but I can see this for you. This is a great opportunity for you.
Oh, definitely. I mean, that's the biggest part of a cosmetic consultation, actually, is, someone will come in and say, this line bothers me, but it's my job to explain to you not only why that line is there, but how to correct it properly. The knee-jerk reaction is to think, oh, you just put filler in the line. But
Right.
there's actually more going on in the face. And I think people start looking odd with cosmetic procedures when you hyper focus on one area and you don't address the entire face. And so that's part of my job is to explain that to everyone because it's not something that people know.
Right. So let's talk about this really quickly before
Hmm.
we go, because we're coming on time. But as far as beauty and cosmetics, it's not a one size fit all, right? It's not a one trick pony situation or one solution. So
Right.
for people who are watching who are into, natural and eating healthy, is there something that you recommend
Hmm.
pairing with cosmetic treatments to slow down the progression of aging?
Oh yeah, definitely. So, number one, everyone should wear sunscreen, okay,
Mm,
because sun damage helps make you age quicker. So you want to make sure you're wearing sunscreen every day, even in the winter, an SPF of 30 or higher.
okay.
Okay. So that's number one. And then antioxidants are something that you want to include in your diet, but also on your skin too. So
Okay.
vitamin C on your skin is really good. Azelaic acid is another one that I
Okay.
like, and I use both every day. And then a retinol on your skin at night as
Okay.
well. Yeah.
So I'm gonna have to ask these questions, and
Mhm.
you may not be comfortable with name dropping, but do
Right.
you recommend a specific brand of sunscreen? Because we complain about the white cast.
Yes, yeah. So that was one of my missions when I was a resident, was to make sure that I tried as many sunscreens as possible to find the right one for my skin. And so I actually have a couple of favorite sunscreens.
Okay.
So one is by La Roche-Posay. It
Okay.
has ceramide in it, and it's a really good chemical sunscreen.
Okay.
Um, Another one is by Elta MD, and that's a mineral sunscreen. So if you're more on the natural side, that's a good one. It's called
Okay.
UV Clear. So
Okay.
that's one that I like.
I'll link all this down
Um,
in the description box, by the way. So thank you.
oh, no problem. And then a third one that I really like is by Bolden USA.
Bold,
They're
say?
Yeah, they're a little known company. It's actually black owned.
Oh, okay.
Yeah, and I met the two owners once at, I think, the Essence Festival
Oh,
somewhere. They were there somewhere. So they're doing their thing. They're out there and they sell it at Target.
okay.
And I think they sell it at Walmart too. So you can buy it online there.
Golden USA.
Yeah, Bolden
Okay.
USA. So they have a really good sunscreen.
And as far as those antioxidants, just give me one antioxidant that's powerful that we can use.
Oh, on your skin?
So did you recommend to topically or to inject when you were saying,
I recommend it topically, but I think a well-balanced diet too is really important.
yes, but the topical antioxidant that you recommend?
Vitamin C.
Vitamin.
So I like the one by Revision Skincare.
Okay.
That's a really good one. And there's also another good one is by Skin Medica.
Skin Medica. Okay.
So Revision, Skin Medica. A really easy one to find too that I like is by The Ordinary.
The Ordinary. Okay. I think they sound familiar. I
Yeah,
think
I use their azelaic acid every day.
so that's the azelaic acid.
Yeah, that's the azelaic acid that I
The
use every
Ordinary.
day.
Okay. And I think there was one more thing. You said a retinol over the
Yeah.
counter.
So I actually use a prescription strength retinol,
Okay.
but if you're looking for an over-the-counter one, something that is closer to medical grade is better than something that's not.
Okay.
So there in the acne aisle, there's something called Differin.
Different. Okay.
Yeah, so we use retinols to treat acne, but it's also for anti-aging as well. So
Hmm.
that would be an inexpensive over-the-counter medical grade retinol that you could use.
There is so many questions to ask you. That's why
Mhm.
we're going to have to follow you on your Instagram to get all the tea. Can you please tell us what your Instagram handle is so we can follow you?
Oh, sure. It's DC_DermDoc.
Okay. And can we catch you online? Can we find you online? Or how do we schedule a consultation with you, whether it's for skin or hair?
So you can actually call the office. That's probably the best way to get an appointment. And the phone number is 301-530-8300.
Say that.
I'm located in Bethesda, Maryland.
We have a lot of people in the DMV and MD. So,
Yeah.
so repeat the number for me one more time.
Sure. It's 301-530-8300.
Yeah, so if you guys want the cocktail and to know exactly how to apply the azelaic acid, the antioxidant, retinol, what goes first, what goes before what, there's a lot. There's a lot
Yeah.
That's why it's best to go see a professional, a board certified dermatologist with years of experience who can help you not only with, your hair as far as PRP or medical hair treatments, but as far as keeping that skin tight and right, as far as anti-aging. Thank you so much. It was such a pleasure.
you.
Akingboye, thank you for joining us, and we hope to have you with us again soon.
Great. Awesome. Thank you. I appreciate it.
Thank you. Take care, Supernatural.
Thanks. You too.